The most common causes of numbness in the hand probably are a condition called carpal tunnel syndrome, which is a nerve that is entrapped in the wrist in this location. But there are many, many causes for numbness in the hand, from conditions that affect the whole body, like diabetes or neuropathy. But as a hand surgeon, probably the most common things that I see are nerve entrapment. So this nerve entrapment can occur from carpal tunnel syndrome, entrapment in the elbow, in the forearm, and also sometimes entrapment within the neck itself as well. So, and if it's only in one hand, the same causes can also occur. And more likely, if it's in one hand, it's a nerve entrapment somewhere. Patients often tell me they think it's a circulation problem, but most of the time numbness is due to nerves being entrapped or nerve having a problem. Okay, numbness in the hand is a very common symptom. Everybody at some point will have experienced the numbness in the hand, but if it's a numbness that comes and goes, it doesn't interfere with your life, and it's very short term, maybe a few hours or a few days, then it's probably fine. The time when numbness becomes serious in the hand is when the numbness is permanently present. That is definitely something one should see a doctor. And I say permanent, meaning if it lasts more than one day. And that is worrying. But if it lasts more than one day, goes away completely, never come again, fine. But if the numbness is there after 24 hours and you still have the numbness, then certainly I would seek advice for that. The kind of causes can be many, mainly nerve entrapments, but also other issues, nerve entrapments in the neck, or circulation problems, or diabetes problems. But as I mentioned, it's very rare that it's something serious, but it shouldn't be ignored if it's permanently present. The tests that I usually perform, number one, when someone has numbness in the hand, seeing a specialist like myself, a good history. We would take a good story about the problem itself, about the patient's background, medical history, injuries and things like that. So a good history, and then a good examination focusing on potential causes for this. And in most cases, this kind of history and examination is sufficient to be able to get a diagnosis. Supportive investigation, sometimes we do something called nerve conduction studies, or EMG. This is done by a specialist neurophysiology doctor. And this is a specific electrical test to look at the function of the nerves. And this can determine the location of where the nerve is trapped, the severity of the nerve entrapment, and whether there are any signs of recovery. We also sometimes do MRI scans for the neck to have a look at causes of nerve entrapment. These are the two probably most common tests that are done. And then there's a whole series of other tests which are done infrequently, sometimes blood tests, sometimes scans of the brain, but they are much more uncommonly done. Most of the time, I would suggest actually if someone has numbness that's there for a long time, permanently, as I mentioned, more than 24 hours, firstly seek an opinion of a professional consultant hand surgeon like myself. We can have a look, but we can prescribe or provide things like splints to be worn. There are some exercises under the supervision of a physiotherapist. We also use simple devices like putting a pillow, for example, around the elbow to keep it supported. There are many strategies like that, but I think these all need to be under the guidance of a hand surgeon, seeing the patient first, rather than starting it yourself.